Receiving results from any medical test can be a moment of anxiety, especially when the outcome is unclear. If you have recently had a tuberculosis skin test, you might be wondering what a positive result truly signifies for your health. No, a positive tuberculosis skin test does not always mean you have active tuberculosis disease. Instead, a positive result primarily indicates that you have been exposed to the Mycobacterium tuberculosis bacteria at some point in your life. This exposure could mean you have what is known as latent tuberculosis infection, which is different from active disease. The tuberculosis skin test, also called the Mantoux tuberculin skin test, involves injecting a small amount of a substance called tuberculin purified protein derivative, or PPD, under the skin of your forearm. If your body has been exposed to tuberculosis bacteria, your immune system will recognize the PPD and cause a reaction at the injection site, usually a firm red bump. This reaction simply shows that your immune system has encountered the bacteria before, not that the bacteria are currently multiplying and making you sick. Latent tuberculosis infection means the bacteria are present but inactive, causing no symptoms and posing no risk of transmission to others. Active tuberculosis disease, however, means the bacteria are actively multiplying, causing symptoms, and can be spread. So, what happens if your skin test is positive? This result serves as a signal for your healthcare provider to conduct further evaluations. These typically include additional tests, such as a chest X-ray to look for signs of active disease in your lungs, and sometimes sputum tests or specialized blood tests called interferon gamma releases assays, or IGRA. These follow-up tests are crucial for determining whether you have latent tuberculosis infection or active tuberculosis disease. Remember, only a healthcare professional can accurately interpret your results and recommend the next steps. One interesting detail is that prior vaccination with the BCG vaccine, which stands for Bacillus calmette-guerin, can sometimes cause a false positive reaction on the tuberculosis skin test. However, the more modern IGRA blood tests are generally not affected by the BCG vaccine, making them a valuable tool, especially for individuals who have received the vaccine. Identifying and treating latent tuberculosis infection is incredibly important because it can prevent the infection from progressing to active tuberculosis disease in the future, safeguarding your health and the health of those around you. Ultimately, a positive tuberculosis skin test is not a definitive diagnosis of active disease, but rather an important indicator that your immune system has been sensitized to the bacteria. It is a prompt for further medical investigation, offering you the opportunity to understand your status and, if necessary, take proactive steps to prevent future illness.